Alright guys, here's a little elbow rotational mobility technique you can do. We can work on supination and pronation. Works pretty good for people that are limited in the front rack position due to pronation. What you'll do is use the band to get a very light distraction to that elbow joint. You'll place the band just slightly distal to the elbow. From here, you can push off with your leg till you get a good little distraction force. And from here, we're just going to supinate and pronate the hand. We'll do about 15 to 20 repetitions. You can kind of hold at the end, but using your free hand to kind of help force that elbow into supination and pronation. You can even work up into the front rack here, and you can even throw in a little bit of wrist extension mobilization while that elbow has a little distraction force to it. Just play around, find some areas that are sticky and kind of work it free. Working on supination, pronation, and again, you can also work a little bit on the wrist extension as well. Great little mobility technique for people that are struggling on one side getting into that front rack position. Alright guys, here's a little elbow mobilization technique. It's real simple. I'm just going to use the momentum of the kettlebell to carry your elbow into a little bit extra supination and pronation range of motion. This is good for athletes that have limited supination and pronation, struggling maybe to get into the front rack because of limited elbow pronation. Of course, you also can get some shoulder rotation, but that's fine. Really focusing more here though on the elbow rotation. So from here, you support yourself with the opposite arm, and you're just going to rotate with some speed, back and forth. That momentum of the kettlebell is really going to help force a little bit of extra range of motion. You can use some voodoo floss, wrap it around the forearm as well, just to help get a little bit of soft tissue release as well. But you just do 90 seconds to 2 minutes on the limited side. Both sides are limited. Just alternate sides, 2 to 3 reps. Great little mobilization for restricted elbow rotation.